Okay. Just want to make sure that everyone can see the slides because I just got a little thing that said participants can now see your screen. So
no, we can see your slides perfectly.
Okay, great. All right, so I will get started. Thank you everyone for joining me today. My name is Carrie Levinson. I am the reference and instruction librarian for the Mount Sinai West and Morningside campuses. And today I'm going to be talking to you about systematic review methodology and best practices. So here are our learning objectives. There are 3 here that we hope you will be able to do. The first one is to differentiate between a research topic or question that's more appropriate for a narrative or literature review versus a systematic review or meta-analysis. Identifying key organizations that are basically the big names in systematic review production. And obviously describing the methodology involved in a systematic review or meta-analysis. And before I go into our first section, which is going to be the differences between systematic reviews and literature reviews, let me actually tell you what a systematic review is. It is a study that answers a really defined research question. Usually it's looking at an intervention. It could be comparing it to another intervention. And it's doing this by collecting and summarizing all of the empirical evidence that fits pre-specified eligibility criteria. So hopefully you are bringing together, basically you're bringing together studies on the same intervention. Hopefully they're looking at similar populations. Hopefully they're very similarly designed. And that's because if you want to do a meta-analysis, which is the statistical analysis portion of a systematic review, you need to have very homogeneous studies. And we'll get into that in just a few minutes. But essentially, you can have a systematic review without a meta-analysis. There is nothing wrong with that at all. And usually systematic reviews are, when we say meta-analyses, so when I'm saying systematic reviews today, you can just sort of say and meta-analyses in your head so that I don't have to keep repeating it. But essentially the methodology is very similar. The meta-analysis is just sort of the statistical analysis portion that's tacked on at the end of a systematic review if it is appropriate. You can have a meta-analysis without a systematic review. It's just not done very often. Okay, so that brings me to systematic versus narrative or literature reviews. And narrative and literature reviews, exactly the same thing. So I'm not going to read this table to you. Don't worry. We're not going to go through each line on this. But essentially, the difference between a systematic review and a literature review, unlike what a lot of people think that systematic reviews are just really, really hard literature reviews. That's not the case. Systematic reviews are focused on a single question. They are intended to answer that question. They are not intended to generalize anything else. And so they are bringing together all the literature that will hopefully answer that question. And they're done in a way that is as objective as possible to reduce any sort of risk of bias. Literature reviews can answer a question, but usually they are a general overview. Usually they're just sort of trying to describe this, sort of the general state of some sort of topic. And they don't have a really rigid methodology like a systematic review does. So once again, I'm not going to read everything here, but you can sort of see clearly identified, clear and explicit, comprehensive. So there is a certain way of doing systematic reviews. That's not the case for literature reviews. There are many different types of ways you can conduct a literature review. It's often done in a sort of hand wavy kind of fashion. So it's the methodology is not clear for how you do a literature review. And it can be done in a very subjective way, because you can have one person doing a literature review. There's nothing wrong with that. That is generally not considered a good idea for a systematic review, because one person selecting all the studies can introduce bias. Once again, you're trying to get as unbiased a report on your question as you can. So generally, systematic reviews have teams, and best practices state that there has to be a team. But that's generally what we are looking at here. So obviously, you're going to still have background and discussion. Those are the same types of things, but you can see sort of that everything else is different, because you're doing the steps in a systematic review in a very clear way, and you're reporting that very clearly as well, whereas you're not really doing that with a literature review. And a literature has a different function, so it's really focused more on an overview rather than answering a specific question. So that brings me to a little activity that we're going to do. I promise you are not being graded or evaluated in any way, shape, or form. I am not connecting your name to your answer. But essentially what I'm going to do is I'm going to read out the titles of articles these are actual articles that have been published in the research literature. And I would like you to tell me whether you think, based on the title, they are a systematic review or a narrative or literature review. So the first one is Childhood Obesity, Current and Novel Approaches. And you can unmute yourself, you can type into the chat, whichever one works for you is fine. So yeah, I'm seeing a whole bunch of narrative, and that is correct. This is a very broad overview of childhood obesity. How about our second one? Clinical effectiveness and cost effectiveness of cytosine compared with Renicline for smoking cessation. I'm already seeing people. Thank you. Yes, so this is in fact systematic. It's looking at one intervention and comparing it to another intervention. Our next one is Problems and Solutions in Delivering Global Surgery in the 21st Century. Yep. Once again, pretty broad. So that is in fact a narrative review. Green tea for the prevention of cancer. What do people think about that? Seeing a couple of systematic.
I would actually say narrative. Sounds very broad to me.
Well, that is a good that's a good point, actually. So this, in fact, as I mentioned, all of these are published. This is actually published as a systematic review. So green tea here is the intervention, and the outcome is prevention of cancer. So we'll get into how you can sort of create that kind of focused question that would be appropriate for a systematic review. But yeah, I mean, you could certainly, there is always a little bit of wiggle room. So there are certain questions that if you approach them in one way, then they become narrative reviews. If you approach them in another way, they become systematic reviews. And then there are other types of review questions that we just don't have time for today. And sometimes those questions are more appropriate for those types of reviews. So yes, I can see how you would think about it. You could think about it in different ways. This happens to be a systematic review in the literature, but that is a great point. And finally, our last one is mindfulness meditation as an intervention for binge eating, emotional eating, and weight loss. Yeah, so once again, this is yet another intervention, and it's looking at a bunch of outcomes, which is possible. So you can look at more than one outcome, but it is an intervention for a bunch of different outcomes. So yeah, hopefully, does that make sense to everyone? Or does anyone have any questions on this? Once again, it can be a little bit difficult to figure out, which is one of the reasons why the library is here to help you. But hopefully this makes sense. All right, thank you everyone for participating in that little activity. And now we will move on to the general methodology and best practices involved in a systematic review. So here's the methodology, it just in a quick nutshell. We're going to go through each of these steps, but this is all the stuff that's involved in a systematic review. Before I really get into the methodology, I want to point out some of the big names that you will either already have seen or you will be seeing if you choose to embark upon a systematic review. The first one is Prisma. You have probably seen a Prisma flowchart in a published systematic review. And you may also recall something saying, we have this systematic review is in line with Prisma Guidelines. And this is what they're talking about. So there are two big things within Prisma. These are basically guidelines to help you with all the elements of a systematic review. Here's the checklist that I just mentioned. And then there's a flow chart, which we'll also take a quick look at in a little bit. So at first, this looks pretty daunting. They have recently revamped this. The original was from 2009. But if you look at this, I know it's a little bit hard to see, but if you look at this, it's really not as bad as it seems at first. So for example, the first checklist item is identify the report as a systematic review. You would be doing that anyway. So basically you just put the page number that it is, that you're putting the title on, and so on and so forth for different sections. You can actually see this as a really helpful guide for making sure that you're including everything that you should be including. And in fact, a lot of journals require this checklist when you're submitting your manuscript. So it's important that you fill it out as or you keep it in mind as you're going along, and then when you actually have page numbers, you fill it out. The Cochrane Collaboration. You've probably heard of Cochrane systematic reviews. They are considered the gold standard for a number of reasons. Their methodology goes above and beyond. They have a handbook, which is freely available. You can also get it through the library, but it is freely available on their website. The handbook is excellent. It is also really dense, so I recommend looking at it, but I don't recommend trying to read it all at once because that's a lot. There are also interactive learning modules that we have from Cochrane available through the library, and I do recommend that you take a look at those because they're a little bit easier to digest and they're very helpful. I've gone through all of them myself. Moose is sort of the same thing as Prisma. So Prisma is focusing mostly on randomized controlled trials because generally a lot of systematic reviews look at interventions that are in randomized controlled trials, but Prisma can be useful for other types of studies as well. But sometimes you're looking only at observational studies, and Moose is a little bit easier to use for those, but it's also a checklist that contains reporting information. Finally, we have grade, and grade is useful for the risk of bias or quality assessment portion of your of the systematic review. So it helps grade the quality of evidence and the strength of recommendations that you might be saying. So now let's actually go into the methodology. I'm just making sure we're doing well with time. The first thing you have to do is define your question. And once again, this is a specific question. What specific question do you want to answer? You also need to think about what data is needed to answer that question. So let's say you want to look at interventions on flu vaccines or something similar. What data do you need to answer that question? Maybe you want to look at different dosages. So maybe you want to look at high dosage flu vaccines. So you need to know the different, the different dosages that the flu vaccine is given in. You also want to think about what will constitute a satisfactory answer to the question that you're posing. So what information do you need for that? And that's going to depend on your question, obviously. And really importantly, you have to think about what falls within and outside the scope of your study. So this is your eligibility criteria, which we'll go into a little bit more in depth in a couple of minutes. But this is really important to figure out early in the process, because you don't want something that you will never be able to stop searching the literature for. So you need to figure out the parameters of your question and what you're looking for. Usually we use PICO to define the elements of a topic. So this is a framework for clinical questions. And the P, I, and CO can be broken down into these elements. So the P is your patients or population. The I is an intervention or exposure. Yes, exposure starts with an E, just go with it. Your C is an optional component. So sometimes you are just looking at an intervention and you're not comparing it to anything else. Sometimes you're comparing one intervention to another. So you can have a C, you don't have to have a C. And your O is the outcome or outcomes that you're looking at. So you need to have one main outcome that goes through most of the studies that you're going to be looking at, but you can have secondary outcomes as well. Usually we use PICO for systematic reviews of interventions, although it can be helpful for other types of questions as well. So here's an example of a question that is getting there. It's not quite there yet, but it's almost there. And it is the Mediterranean diet helpful for patients with advanced chronic kidney disease? Why is it not the exact focus question that we want? There are two main problems with this. So the first one is, what do we mean by helpful? A lot of things could be helpful for patients with chronic kidney disease. We need to figure that out. We need to define that. The second one is, what do we mean by advanced chronic kidney disease? Do we mean stage 3? Do we mean stage 5? Do we mean stage 3 through 5? What do we mean? So we have to figure that out. And that's something that your team will have to come to a decision about. So here we have determined that for us, for our theoretical team here, the population is only going to be patients with stage 5 chronic kidney disease. Our intervention is the Mediterranean diet, which is well enough defined that we don't really have to go into too much about it. We can compare this to the standard American diet, other types of diets if we want to. We could also just look at the Mediterranean diet. And we have defined helpful here as improved kidney function as measured by sustained or improved eGFR and the delayed initiation of dialysis. So that's what we mean by helpful. And that gives us a parameter so that we're not just sort of saying, oh, that could be helpful, that could be helpful, all these articles could be helpful, and then you can just never stop. And then we get our focused question, which is, among patients with stage 5 chronic kidney disease, does adhering to a Mediterranean diet improve kidney function and lead to delayed initiation of dialysis? Does it make sense to everyone how this is a searchable and answerable question, whereas this one, you could try searching, but you're probably going to get really frustrated in searching at some point? Does the transformation make sense to everyone?
You mentioned there should be only one outcome, but don't we have 2 outcomes here?
Well, you have to have one main outcome, but you can have other outcomes as well. That's a good question. But yes, you can have more than one outcome. Any other questions? All right. So once you have your question, you want to search the literature. You're going to do 2 big searches here. So the first one is preliminary searching. And this has a few goals. The first one is to make sure that no one has done the same topic as you have within the last 2 years. Because if they have, if you attempt to do a systematic review on the same topic, a journal editor is going to find that recently published one and say, okay, what is the difference between these two? Why should I publish yours when there's already something that's already out on this? And you're also probably not going to have enough literature, new literature, to synthesize. So you don't want to waste your time on something that's already been done very recently. And so there has to be some sort of gap in the literature where, where this would contribute to the literature. And the second point is to make sure that there's actually enough for you to systematically review. You can have a really great question that's really interesting, but if there's only one study, there's nothing for you to systematically review. There's one study. There isn't a minimum number of studies that I would say you need to have. I would say, if you're really looking for a number, you probably want to make sure there's at least 3 to 5 articles. But it can vary. But there has to be enough for you to actually do something on. And if there is enough evidence, what type of evidence is there? What types of studies are out there? And this goes back to meta-analyses. So are the existing studies sufficiently homogeneous to allow for statistical analysis on them? Because if they're not, you can't do a statistical analysis on them. You can't do a meta-analysis. And once again, that's fine. There are systematic reviews all over the place that don't have meta-analyses and that still are well conducted and answer the question that they've posed. But that's just something to keep in mind if your heart is really set on a meta-analysis, that the studies have to be similar enough. So the process here is to do some keyword searching. You're not doing a very exhaustive search here at this point. You can look in PubMed, you can look at Google Scholar. You also want to look at Prospero, which we're going to look at in just a minute. And that is the registry, the main registry for systematic reviews and meta-analyses. So this is where people write their protocols and then they post them. And that's our next step, drafting a protocol. So what is a protocol? It's basically the roadmap of your systematic review. And this is where you decide in advance all the different steps you're going to take. And you're putting it out on paper for other people to see. So you're going to state what databases you search, you're going to search, what instrument you're going to use for the quality appraisal risk of bias section, what your eligibility criteria are. And let me tell you a little bit more about what eligibility criteria are. So for the question that we just looked at on the Mediterranean diet and chronic kidney disease, we determined that our patient population was only going to be stage 5. So we are excluding everyone who's not stage 5. So that's one thing you can look at. You can say, we're only looking at randomized controlled trials. We are not looking at any other types of studies. You can say, we're looking at mindfulness interventions, but we're defining these as breathing exercises, meditation, and nothing else. So if there's an article on yoga, no, that's not how we're defining it. So that's what you have to think about beforehand. And there are a couple of reasons for this. The first thing is to create a comprehensive study plan, so you don't need to keep going back and forth. Systematic review is supposed to be clearly, has a lot of clear steps in it that you're reporting in a clear and defined manner. If you keep going back and forth, it's going to muddy the process and also make you very frustrated. And the second thing is to claim your topic. So that's also why you're searching in Prospero for your preliminary searching. So if you claim your topic, it announces your intention to do the systematic review. And so other people who are not, at that level, at that point in the process can say, oh, they're going to get theirs done before us. We should choose another topic. And that brings me to Prospero. So this is for systematic reviews and meta-analyses. It's the most popular registry site. There are other ones, but this is the one that most systematic reviews and meta-analyses go into. And I'm just going to pop over to it really quickly. I just want to make sure that my screen switched over. So hopefully everyone can now see Prospero rather than my slides. Let me know if you can. Okay, I'm gonna take that as a yes. You can see Prospero. Okay, thank you. All right, so here is where you can search. So I'm just going to do a quick search here, and this is where you register. So you would register your protocol there. And this is also a place where you can see Cochrane protocols. So this logo here is the Cochrane Collaboration logo. And let's see, let's just click on one of these. We'll click on that one. And you can just see, we're going to go through this very quickly, but you can see what a protocol generally looks like. So it has the question, it has the searches they're going to do, so the databases that they're going to search in. Cochrane tends to be a little bit extra, so they are searching a whole lot more databases than is the minimum requirement. The types of studies they're including, there's their PICO, so P-I-C-N-O. So you see here that there's a main outcome and then there are additional outcomes. How they're doing their data extraction, their risk of bias or quality assessment, their data synthesis process, and then information about their team and also where they are in their review. So once again, this is a Cochrane protocol, so it is more detailed than you need to be, but I find them good to just take a look at in case, if when you are trying to write your own protocol, it's a good template to look at. Prisma also has an extension for protocols that you can take a look at. It's also a checklist of things. I will just mention right now, so the library is happy to help you with your systematic review, and I'll show you the guide at the end of this where you can fill out a form if you'd like to get help. But we now require that you send us your protocol before we schedule a consultation with you. So there is one of the modules in the Cochrane Interactive protocol, the Cochrane Interactive modules is on protocols, as well as Prisma P. I can send both of those links for anyone who's interested in them, and that they can give you guidance on how to write the protocol. Okay, so once you have figured out your roadmap, you're going to do the big search. And this, once again, is where the library can really come in and help you. And the idea here is to identify all potentially relevant studies. So literature review, you can kind of pick and choose a little bit. And just, until you have a general overview. Systematic reviews, you find everything that could potentially be relevant. So the best practices here, you want to search at least 3 databases. You can search more if it's relevant. You want to use both index terms and keywords. And by index terms, I mean, if you are familiar with PubMed, mesh terms or index terms, these are basically the subject headings in databases. You also want to think about the different synonyms and relevant words that can describe the concepts to answer your question. Because you're supposed to, you're trying to be as objective as possible, you may want to include sources of gray literature. Gray literature is basically unpublished literature. It's things like conference abstracts, working papers, preprints, and this is to reduce the publication bias that can come up in literature. You should also not be using a date limit unless you have a really good reason. So once again, you're trying to identify all potentially relevant results. If you say, well, I really just want to search the last 10 years because I don't really feel like searching through more than that, that is not a good reason. A good reason is, for example, we're looking at this intervention, we're looking at this procedure that was invented in 1995. So searching the literature before 1995 would be pointless because that procedure didn't exist. That's a good reason to start searching 1995 on. But just keep that in mind, you will be asked about that. So this is sort of heading off questions of the past. Don't use it just arbitrarily if you do want to use a date limit. So here is the first 2 pages of a search strategy in Medline. There are, I think, 2 other pages of this search strategy, and I'm not showing you this to scare you. I'm just showing you this to emphasize that search strategies can get quite complex. After you run your comprehensive search, you then want to actually identify the really relevant results, not the potentially relevant results. And this is typically conducted in 2 rounds. We do have a software called Covadence, which is really helpful for this screening process. And I will show you that once again, that's in our guide at the end. But this is 2 rounds of screening. So the first round is title abstract screening, where you're just looking at the title and abstract, as it says in the name, and you're getting rid of the results that don't fit your eligibility criteria. And the ones that do appear to fit your eligibility criteria go into the next round, which is reading the full text. So reading the whole article of the studies that you identified in the first round. Once again, you're going to eliminate the results that don't fit that eligibility criteria, and whatever is left goes on to the quality appraisal or risk of bias assessment. So there are a couple of things I want to point out about this part of the process. The best practice is 2 independent reviewers review each result in both rounds of study selection. Let's say you have 1,200 results in your search. This doesn't mean that one of you screens 600 and the other one screens 600. It means that you both review 1,200. And I just want to give you an idea of the time involved here, because this is a big thing. So let's say that it takes you about a minute to review 2 citations in the first round of screening. And you have 1,200 citations. That will take you 10 hours. For the second round, in which you are reading the whole article, that is going to take you longer than just reading the title and abstract. So let's say you get down to 50 articles, which is completely plausible. You are not going to have to read 1,200 full text articles. And let's say it takes you 30 to 45 minutes to read an article. At the worst, 45 minutes. If you have 50 articles and it takes you 45 minutes to read an article, that will take you 37.5 hours. So I really want to point this out because systematic reviews are a very large time commitment. So you really do need a team that has the time and the motivation to do this, because we often, not often, but sometimes we have teams that come to us and they think that they're going to do the whole thing in a month. And that's really not the case. Typically, on average, systematic reviews take about a year. Sometimes they take a little bit less, sometimes they take a little bit more, but generally about a year. So please keep that in mind. If you are interested in doing one of these, it will take you time. So here's an example of a screening flow diagram. So this is the flow chart that I was talking about, the Prisma flow chart. This team started off with about 3,000 articles. They deduplicated them because they were coming from several different databases that have some overlap. So they actually ended up having to screen about 2,200. They excluded most of them in the title abstract screening. So that is typically what happens. And they only had to read 39 articles. Then they excluded most of those And here you give the reasons why you're excluding those. And so in their actual review, they only included 8. So this is a very typical flow chart for a systematic review. You may start off with a huge amount. It's not unusual to start off with thousands and thousands of articles, but you're not going to end up with that many. So this is our recommended workflow. You are going to do your search. You're going to do all your searches in all the databases on the same day. And then you save them so you can report them. You export them into a reference manager. And that's so you have the citations available to you. And then you will upload your results to Covadence, which is that tool I mentioned before, which deduplicates and also generates a flowchart for you. And then you can screen your articles from there. So in Covadence, you have the titles and abstracts to begin with. You click on yes or no if you think it fits and if you think it doesn't fit. So it makes things a lot easier. So moving on, your quality appraisal section is to assess the quality of evidence, to see how definitive of an answer your analysis is going to be able to provide, as well as to determine the quality of evidence there is. So basically the risk of bias in the way these studies were conducted. So this is an example of the Cochrane risk of bias tool, which is one that's used a lot with systematic reviews of interventions. The green means low risk of bias. The yellow means an unknown risk of bias. We can help you with choosing an appropriate tool for this. And the best practice is it's mandatory. You can't skip this step. It's a very important part of a systematic review. Then you have your data extraction and synthesis. The first goal in your extraction is to obtain relevant data points. So you're basically going to have a spreadsheet. Covadence also has a spreadsheet within it. And this depends on your topic. So you could be extracting sample size, you could be extracting study durations, whether there was masking, if you're looking at randomization and blinding. Lots of different things you could pull out depending on your relevant data points. And then you're going to utilize that data to hopefully find an answer to your question. So this really depends on what kind of methodology you're looking at. But basically, in the extraction process, you're hopefully reporting by this point on similar variables. And your synthesis is to tell readers something that wasn't clear just by looking at the individual studies. Finally, you get to write your paper after all that. That is another topic that we could spend a long time on, so I'm not going to go too much into this. But your lofty goal here is to make a meaningful contribution to the corpus of scientific knowledge. And your practical goal is, of course, to get something published. So basically, when you are thinking about whether you would like to embark upon a systematic review, these are the major elements that you should really have. You have a clearly defined question, available studies to actually synthesize, a gap in the literature so that no one has done this very recently. You really need a motivated team, and you really need time for it as well. Does anyone have any questions at this point? And I'm just going to flip over so I can show you our guide as well. So I will actually also put this into the chat box so that you can see that. So this is our guide. It goes into what each of these, I mentioned other types of reviews, those are over here as well. But you can get an idea of the differences here as well. This is Covadence. So there's a little video that my colleague put together on how to use it. and you can request access to our subscription through that. And this is the consultation request form that I mentioned before. So if you are interested in this, please feel free to contact us. We are happy to help you. As I mentioned, if you click on research synthesis, it's going to ask you about a protocol. So we do require that you give us one so that we have a better idea of how to help you. And I will also put my email address into the chat box as well, in case anyone thinks of anything afterwards. Please feel free to contact me. I'm happy to help you. We can also help you in case you are not sure whether the question you're interested in or the topic you're interested in would be appropriate for a systematic review. That's something we can help you out with. Yes, so happy to answer any questions right now, and happy to answer any questions that you might think of later. So thank you once again for having me here today.